It's a place built on magic, where dreams are supposed to be the only thing contagious. But on January 28, 2026, public health officials issued a sobering reality check. An infectious international traveler spent a day at the Disneyland resort, turning the happiest place on Earth into the epicenter of a potential public health crisis for the second time in a decade. The exposure windows are precise. Goofy's Kitchen from 10:30 a.m. to 1:30 p.m. The parks from 12:30 p.m. until closing. Anyone present was in a cloud of potential infectional cloud they couldn't see, smell, or feel. Because the pathogen in question is one of the most perfectly evolved spreading machines in nature. The measles virus, this isn't just a repeat of 2015. This is a stress test on a weakened system. We're facing a triple threat. A generation of vaccine-hesitant parents, waning immunity in older adults, and a virus whose contagious power is almost unimaginable. The 2026 Disneyland alert isn't an anomaly. It's a flashing red warning light for the entire country. To understand why, we need to dissect the biological masterpiece that is measles. Let's talk about contagiousness. The basic reproduction number, or RO. For the flu, it's about 1.3. For the original COVID-19 strain, it was around 2.5. For measles, it's between 12 and 18. One person can infect a small classroom, or a theater full of people watching Here's its diabolical method. An infected person coughs or sneezes, releasing virus-laden droplets. But measles doesn't just fall to the ground. The smaller particles, called aerosols, can hang suspended in the air in a queue for Pirates of the Caribbean. In a bathroom, in a restaurant for up to 2 hours after the infected person has left. You can catch measles simply by breathing in a space where an infected person breathed 2 hours earlier. Once inhaled, the virus targets the immune system's very own sentinels, alveolar macrophages in the lungs. It hijacks them, using them as a Trojan horse to travel to the lymph nodes. From there, it launches a systemic invasion. But the true horror of measles isn't just the high fever, the photophobia, the cough, or the signature head-to-toe rash. It's what scientists call immune amnesia. Measles doesn't just attack you. It attacks your biological history. It specifically infects and destroys your memory B and T cells, the specialized libraries of your past, infections, and vaccinations. Studies show it can erase 11% to 73% of your protective antibodies. You don't just recover from measles, you emerge with a partially wiped immune slate, vulnerable to diseases you were once protected against 4 months or even years. Measles resets you to a more immunologically naive state. This is why the 2014-2015 Disneyland Outbreak was a watershed moment. It wasn't the size 147 US cases, it was the symbolism. It happened in a wealthy, developed state at an iconic location. It proved that vaccine hesitancy had tangible, dangerous consequences. The virus strain, B3, was a traveler itself, likely imported from the Philippines. The outbreak became the definitive case study that pushed California to pass SB, eliminating non-medical vaccine exemptions for schoolchildren, law that has since been a model and a lightning rod. And now, in 2026, we're testing the limits of that law. Vaccine exemption rates are creeping up in pockets across America. Furthermore, we have a new population at risk. Adults born between 1963 and 1989 who may have only received 1 dose of the MMR vaccine or whose immunity has waned over decades. They walk through airports and theme parks believing they're protected, but their defense may be a ghost. The 2026 exposure case is likely one of these scenarios, an under-vaccinated adult traveler or a child from a community with low coverage. So what does the 2026 Disneyland alert mean? It is a containment success story in progress, showing our surveillance systems work, but it is also a brilliantly bright flare, illuminating the cracks in our herd immunity wall. Measles is the canary in the coal mine. If it can spread here, it means our community protection is fragile. The solution is not fear. It is action. Check your vaccination records. If you're an adult, unsure of your status, a simple blood test can check for antibodies. If you were at Disneyland on January 28th, follow public health guidance. The magic of Disney is engineered illusion. The science of immunity is not. It is our most powerful shield. In 2026, we are being reminded, once again, that we must actively choose to maintain it. Stay curious. Stay protected!